Okay, good afternoon, everyone. I think a couple of people are still joining as we start, but I think since it's time, we'll start the webinar. So good afternoon, everyone again, and good morning for some of you. Thank you very much for joining today's webinar to launch the white paper, Unlocking Progress, Dengue Policies and Opportunities in Asia. My name is Rie Tai, and I'm the manager of the Asia Dengue Policy Working Group. We are a multi-stakeholder initiative dedicated to improving dengue outcomes across the region. And this past year, we have spent a lot of time developing a dengue map of policies across the Asia region, and have also developed now this white paper that we will present to you today. So today's session is dedicated to sharing the findings and recommendations from our policy map and the landscaping efforts that we have conducted over the of the 10 countries. Through this work, we've been able to identify key policy gaps, highlight best practices, and propose actionable recommendations that support the WHO's goal of zero dengue deaths by 2030. We have a packed agenda for you today. We'll start with some brief introductions about the organizations involved to set up the Asia Dengue Policy Working Group. And we also have a special recording from Professor Tiki Pangetsu, who has endorsed our activities also during the launch of the Policy Working Group last year. We will then present and highlight the insights from the policy map that we have conducted, and also do a readout of the regional and national recommendations that we have included in the white paper. This will then be followed by a panel discussion with two distinguished dengue experts, Professor Egi Arguni and Dr. Bhaskar Shenoy, who will explore the path forward of dengue policy in Asia. Now, with that, let me hand it over to Will Brown, the director of the Policy Working Group, to introduce the organizations involved with the Policy Working Group.
Thank you, Rie, and thank you all for joining us today. My name is Will Brown. I'm the director of the Asia Dengue Policy Working Group, or ADPWG. We established this group last year as a multi-stakeholder platform with a clear goal to advance evidence-based dengue policies and contribute to the WHO vision of zero dengue deaths by 2030. So our working group brings together a diverse set of stakeholders from governments, academia, civil society, and industry to foster collaboration, share knowledge, and provide policy guidance that is tailored to individual country contexts. What I'll do next is to introduce some of the leading organizations of the group. I'm sure most of you are familiar with Asia Dengue Voice and Action and Dr. Francis Kwong, who is the Secretariat for ADVA. For those who aren't, this is a scientific working group that also aims to decrease the burden of dengue across Asia and also work towards that same WHO goal. One of the main activities of ADVA is running the annual ADS, Asia Dengue Summit, which is fast approaching us, actually, in a couple of weeks' time in Manila in the Philippines. So ADVA is sort of the founding member of the Asia Dengue Policy Working Group, and we work very closely with Francis and the steering committee to ensure that we can bring both of these missions forward. For, I guess, a little introduction to some of the other people that you will hear from today, Rie, who opened up for us, myself and David, and the team, Kim and Tammy, who make this all possible. So we are the knowledge and operations partner for the Dengue Policy Working Group. We are from a company called Vista Health, which is a global advisory firm in the healthcare space, and we operate through our non-profit arm, EquiHealth, to contribute to the Asia Dengue Policy Working Group. So we work with Francis and the steering committee at ADVA to pull all of this together. So I think just to also introduce the other organizations and partners that we work with as part of the policy working group. I won't name each of them individually, but really just to highlight both the depth and the breadth of the partners that this group works with, which is absolutely critical to our success to ensure that we are able to draw in expertise from a range of organizations to also to ensure that we can facilitate that cross-country and cross-organization expertise and ensure that we are helping all of our partners also move towards their goals as well. And specifically for the white paper that we'll be discussing today, very grateful to many of the expert representatives from these organizations for their contributions and review of the white paper. Finally, just to highlight, I guess, a few of our activities since our formation just over 1 year ago now. We have been sort of present and attending a wide variety of conferences, events, and meetings, ensuring that we are making those connections, getting the word out there, and presenting findings from our work. So it's been a busy 13 months so far, and a lot more planned for the rest of this year. But really kicking off with the launch of this seminal white paper, which will show across the region what is the current status of dengue policy, and crucially, what are the recommendations to move it forward. So without further ado, I hope that's given a good introduction. Unfortunately, Prof. Tiki could not join us in person today, but he was kind enough to leave a recorded message to share his opening remarks to open up this webinar today. So I will hand over virtually to Prof. Tiki to hear those opening thoughts.
Good afternoon, everyone. Apologies for not being with you in person, but I just want to give you a short message. Dengue poses an increasingly complex and urgent challenge across Asia and elsewhere in the world. Driven by urbanization, climate change, the fragility of health systems, and people movements in the region, the disease now demands and requires a sustained, coordinated, and evidence-informed policy response. On the bright side, we have seen exciting new innovations and knowledge in recent years. This is related to improvements in vector control, in diagnostics, and importantly, the development of promising new vaccines to prevent dengue, which I think if you take these collectively, represent a huge, let's say, potential in our efforts to detect, prevent, control, and manage dengue across all countries and regions. However, new knowledge and tools must be translated into actions. And this requires strong evidence-based policies, which is supported by robust health systems, strong political will and commitment and resources, and importantly, regional solidarity and cooperation. This white paper from the Asia Dengue Policy Working Group offers a critical overview of the current policy landscape in Asia. By mapping strategies across 10 countries in Asia, it highlights not just the key gaps, but also provides actionable recommendations to guide policy optimization at both national and regional levels. At the national level, we must always remember that the best way to prevent the regional and global spread of disease is to contain them while they are still local. So for this to happen, that's where we need strong and resilient health systems at the national level. And for the health system to achieve this goal, we need the policies to aim for a holistic and integrated approach to the prevention, control, and management of dengue. At the regional level, we need trust, goodwill, and solidarity between countries in the region, which really emphasizes the importance of shared tools, aligned frameworks, and importantly, cross-border data sharing and research collaboration to strengthen the resilience of health systems at the country level. Dengue is a regional challenge that requires a collective regional response. This white paper provides an important and valuable foundation for policy leaders and other stakeholders in the region to collectively align efforts, accelerate innovation, and importantly, advance equitable access to dengue prevention and control measures in the region in the future. Let me leave you with the words of Goethe, who said, "Knowing is not enough, we must apply. Willing is not enough, we must do." Thank you very much, and I wish you a successful meeting and launch of the white paper. Thank you.
We'd like to thank Professor Kiki for sharing the recording with us and really encouraging us to discuss the importance of policy shaping to prioritize dengue at the national but also regional level as well. I'm now pleased to introduce the Dengue Policy Map, which is a cornerstone activity that helped shape the white paper. The policy map represents a comprehensive effort to assess and compare dengue-related policies across 10 countries. And just to show you as an illustrative, the left-hand side shows the policy map, which includes the assessment of the 10 countries, and we looked at different pillars from surveillance to vaccinations to diagnostics to care management. The insights from the policy map then help shape the white paper that we are conducting this launch event for. But before we go into the white paper, I would like to introduce how we completed this policy map and some of the key findings that we have conducted. Now, the Asia Dengue Policy Map, as I mentioned, is a comprehensive assessment of dengue's policies across the Asia region. We examined each country's dengue landscape across multiple pillars, which includes looking at the national legislation, national programs of dengue, but also dengue-specific programs including vector control, entomological and patient surveillance, the advocacy and adoption of vaccines, strengthening diagnostics and dengue case management, and also improving dengue patient care and management. From a health systems perspective, we also looked at how the community is being engaged, how there could be improvement in impactful community engagement, the improvement and transparency of funding and resource allocation across the different dengue-specific pillars, and how then to enact policy change. For the policy map, we looked at 10 different countries. These 10 different countries were selected to have a mixture of different healthcare systems, but ensure that they also have that they are a high dengue burden area. So these countries consisted of Singapore, Malaysia, Indonesia, Thailand, the Philippines, Vietnam, India, and in particular Karnataka state as a representative of a state in India, Bangladesh, Cambodia, and Sri Lanka. Now, how did we do the policy map? We developed a rubric that we assessed across the 9 thematic areas that I mentioned in the previous slide. But then through desk research and through publicly available information on policies and dengue programs, we assessed the maturity, comprehensiveness of these programs across these 9 pillars. And to validate the desk research, we interviewed experts in the dengue and health policy space to ensure accuracy and local relevance of the insights and recommendations that we are providing. So again, we would like to thank the experts again for their time and their insights to help complete this policy map. Now I'd like to share here an initial assessment of what we have completed looking across the 10 countries. On the left-hand side, you will see different parameters that we have looked into, and this is really just a high-level summary of the different comprehensiveness of the policies. But you can see we looked into whether or not there was a national legislation or act on dengue or infectious diseases. We looked at if there was a national dengue plan, so not legislation, but more of a program. We also looked into resources and allocation and how that was being divided up across the different pillars that we had mentioned, whether or not those resources were written out and transparent. And then lastly, looking at the involvement of different stakeholders. So are decisions being made at the central level? Is it decentralized? Therefore, it is fragmented. So you can see the different, the Harvey balls, that the darker full circles are optimized and the quarter full is considered a basic assessment. So you can see that from this initial assessment that Singapore and Malaysia, they have comprehensive national legislation covering dengue. When we then look into Indonesia and Thailand, they also have programs relevant to dengue, which are quite comprehensive as well, but they do not have a specific dengue task force to manage and streamline all of these activities. Further down, when we look into the Philippines and Vietnam, based on publicly available information, resources on how funding was used for different different dengue prevention and control activities were not as clear, hence the lower scoring. And then it quite varies amongst India, Bangladesh, Cambodia, and Sri Lanka. So there's more variety in the level of optimization of these of dengue legislation and programs. Thought what was quite interesting was that in Sri Lanka, while there may not be a national legislation in place, they had a very comprehensive dengue program, which included all aspects from surveillance, case reporting, and prevention, hence the fuller circles below. So you can find the policy map and further insights on details of these assessments from the PDF that we'll upload on our website. So that will be accessible after the launch meeting. Just to provide a little bit more insight into or introduction into how the policy map is put together. On the left-hand side, we have a summary policy map per country. So for each country that we looked at, we have a summary slide that highlights the key takeaways across each of the pillars, which has an overall assessment on the rating. So a darker green means it is more optimized, and a lighter green means that there's further areas of improvement for policymaking and program development for the pillar. We then go into for each of the pillars. So for example, if we're looking into vector control, within vector control, we go into a deeper dive on the assessment of each of the vector control activities, which could also include, education awareness, the different parameters that are used to track vector control programs and its impact. So those slides are detailed per pillar. As well. So overall, the policy map is quite comprehensive, quite long, but we also have key recommendations per pillar as well for each of the countries. So we hope that this is a tool that can be used to understand the current landscape of different dengue-related policies across the Asia region. And again, this helped highlight the targeted and develop the targeted recommendations that we have developed in the white paper. Also to note, if you do have any questions about the white paper or about the material that we're presenting today, feel free to share in the chat, and then we'll get back to you after the webinar. Okay. And with that, I'd like to do a readout of the recommendations that we included in the white paper. So these are screenshots of the white paper that will be available to you after the launch of webinar. We'll also email you the links so that you'll have direct access to the white paper. Now, the white paper is also a very comprehensive program and document. We have 4 different sections, just to highlight what they are here. The introduction includes the overall dengue burden across the different countries. This also highlights the key unmet needs and challenges that we were able to identify through desk research, but also through the policy map. Then we also included the dengue landscape in terms of policy optimization across the countries. This presents an overview of the current dengue situation with an assessment of existing dengue-related legislation and policies. And then we go into the deep dive into the current policies by pillar. Now, this provides an overall assessment of the dengue-related initiatives and programs across the pillars, so community awareness and education, vector control, entomological surveillance, case reporting, dengue vaccination, and dengue diagnostics, patient care and management. And across each of these different pillars, we provide a snapshot of the different countries and where they are at in terms of their programs that are developed. We also include some case studies of countries where their, for example, vector control program is best in class, and there could be learnings taken from these programs that can be then shared with other countries. So we hope that this section not just provides a snapshot of the current situation, but also includes examples that can be applied within for other countries as well. And lastly, and probably the most important and interesting section, we have the recommendations to achieve zero dengue deaths by 2030. We've broken up these recommendations into 3 separate sections. The first one are regional recommendations, which I can go through in a little bit later. We also have overarching national recommendations for applicable to all countries, but of course can be adapted based on the country's current situation. And then the country recommendations, and these are recommendations that are specific to each country based on the current dengue policies and programs across the pillars, but also based off of insights from experts that we had spoken with and what the priority should be for that country. And before we go into the specific recommendations, we mentioned that the policy working group is a representative of a group of diverse stakeholders. And to make policies happen to not just to advocate, but to implement policies, we need cooperation from a wide network of stakeholders. So we wanted to introduce some of the key stakeholders that we have mentioned in the white paper, starting with national policymakers and local policymakers. They are key to setting the strategies allocating resources at the national and maybe even to the regional level, and ensuring policies are being implemented on the ground. Following that, we have researchers on the bottom left-hand side, and researchers are critical to generate evidence and translate it into policy guidance and for evidence-based decision-making. Next, we have healthcare professionals in the middle left-hand side. They provide frontline support by raising awareness of dengue severity and symptoms, as they are those in touch and speaking with patients. They're able to promote early care seeking and offer clinical insights to inform evidence-based policymaking. We also have industry on the top right, who are also key in supporting innovation, supporting public-private partnerships, and to also then support implementation and inform policy decisions. And then lastly, on the bottom right, we have multilateral organizations. They help coordinate efforts by providing funding, expertise, building capacity, and bringing together different countries at a regional level. So all of these stakeholders play a distinct but also complementary role in policy shaping and implementing and sustaining policy responses to dengue. Now, starting with the regional recommendations that we have highlighted in the white paper, there are 3 in total, but I'll go through them in order here. When we had conducted the policy map and also started developing their recommendations, we noticed that there had already been frameworks that exist at the global and regional level. For example, there are WHO, ASEAN frameworks on infectious disease management. So instead of reinventing the wheel, we would like to ensure that countries review and integrate existing frameworks, making sure that their national dengue strategies align with regional efforts. So this alignment should help reduce disparities in dengue response and capacity, should also support the adoption of shared protocols and elevate the visibility of national efforts. This by making sure that we look into regional frameworks, this also ensures that it develops a platform that allows knowledge sharing across the different countries to strengthen the capacity at a regional level. The second recommendation we had was developed is development of the dengue prevention control toolkit. And this was developed as we were reviewing the different policies that some countries may have a very effective, say, vector control program. However, case reporting was still, it still could be optimized. And different countries had different strengths and weaknesses. And based on the current situation or the infrastructure of the country, there may be different applications of the program that need to be applied. But by developing a toolkit, so this would be a shared menu of evidence-based interventions that have worked in other countries, by having this toolkit available to all these different countries that are at a regional level, this could help promote the flexibilities for countries to scale or adapt these interventions based on the needs of the country. So they wouldn't have to create a program from scratch. They can assess whether or not there are gaps in their current programs and see where they would like to supplement based off of this menu of evidence-based approaches. And then lastly, we have the establishment of a regional data sharing and research collaboration mechanism. So the first 2 points, is the foundation, and the objective is to also share data, but also best practices to ensure research collaboration. By developing this platform, this provides a dedicated regional mechanism for sharing surveillance data, policy insights and research findings that would be not just helpful for one's country, but can be shared across others. And this can support and strengthen real-time response and evidence-based planning, especially in a world where we live in and there are no borders. Information sharing across borders, across countries becomes quite important when infections can be carried across borders through travel. So by making sure that surveillance data is shared across the different countries, we'll be able to have a better grasp of how outbreaks are being managed or how it could be better managed, how resources can be better utilized and shared across the different regions, and would be a tool to support the regional management of dengue. So these are the 3 key recommendations at a regional level. This, of course, requires leadership at a regional level as well. And this is something that we aim to tackle as the policy working group to get the conversation started with regional policymakers. This white paper really is a tool to get the conversation started, and we also encourage everyone here as well to use this white paper as a tool to engage with your local regional stakeholders to ensure there's more regional collaboration. Next, we'll go into national recommendations, and these national recommendations are right now comprehensive and can be applied to all of the countries. We, of course, have country-specific recommendations in the white paper, but we wanted to share overarching national recommendations first. Of course, based on the infrastructure and maybe the established nature of some countries, not all of these recommendations will apply to the fullest, but can be adapted based on the context of the country. So at a national level, the first recommendation is to establish a national dengue task force to drive multi-sectoral coordination. Now, this came from looking at different countries that may have a lack of national dengue vaccination guidelines or fragmented surveillance systems or insufficient or fragmented financing across the different programs. By having a central national dengue task force, all of this can be streamlined and also collaboration across multi-sectors from the Ministry of Finance, Environment, Health, Tourism, and Urban Planning to all have the same dialogue to ensure that dengue is being prioritized at the national level. Some countries already have a task force developed, so this recommendation may be more of a reminder to make sure that discussions are being still held through a multi-sectoral lens, and that is being comprehensive. The second is to position dengue prevention as a national economic and development priority. This is a recommendation that we have developed as we were looking at how we can include other non-health care sectors as well. Dengue impacts not just the health of our people, but also can impact our national economies as well through healthcare costs, loss of productivity. There's also disruptions in tourism and in trade. Framing dengue as a cross-sector challenge. This may increase political attention and help mobilize wider support. So this is perhaps a newer lens of how we could tackle dengue policies, but of course a very important perspective to make sure we incorporate as we conduct further discussions, so that it is not just from a health perspective again, but multi-sectoral, including the impact on the economy. And then lastly, the overarching national recommendation is to ensure transparent and equitable allocation of resources. As we were doing the policy map, we had identified that resources are not always transparent, or at least not publicly available. And therefore, it is hard to distinguish how much of the resources are used for one activities. Is it based on need? So making sure that the information on, outbreaks, surveillance is publicly available, hence then helps the transparency and equitable allocation of resources. So resources should be allocated based on epidemiological data, the vulnerability of the population, and the capacity of the local population as well. The funds should be transparent, as I mentioned, as this can build trust and strengthen investment from donors. And we should also be looking into diversifying the source of funds as well. This ensures sustainability of the funds, and it could be explored through innovative financing mechanisms. We had mentioned multilateral organizations as key stakeholders, and they can also play a key role ensuring that there are sufficient sources of funds for dengue, and as is still a rare, as a disease that needs prioritization. So these recommendations here, is not a one size fits all. These are overarching recommendations that can be adapted based on the needs of the country. Okay. We also wanted to highlight here that in the white paper, we provide country level recommendations as well. So these were developed based on the insights from consultations with experts and identified gaps using this policy assessment rubric. These gaps reflect missing policies across the different layers. You can, once you have the white paper, you can zoom in a little bit further, but we look into, community awareness, vector control, entomological surveillance, case reporting, vaccination, diagnosis, and care management. So we scored the comprehensiveness of programs of each of these countries on a score of 1 to 5. With the lower scores mentioning that there's no existing plan, at least publicly, and 5 stating that there is strong implementation of the program. So you can see here for Malaysia, there is a score closer to 5. For vector control, as we understand, there are Wolbachia programs being implemented at a national level. There's a lot of education at the community level on vector control methods and prevention methods of dengue being disseminated, hence the 5. So this provides a snapshot of the current situation, but also the key recommendations that we have at the country level. So just to go through for Malaysia, on the map, on the spider diagram, there's some areas of improvement for community awareness and education, but also vaccination, as the vaccine is only conditionally approved in Malaysia. However, the recommendations that we want to highlight here is comprehensive, and not just looking at the results from the spider diagram, but what is really needed in the country. And this is also based off of the expert insights that we have collated through the interviews. But for example, for Malaysia, there's a need to prioritize equitable access to high quality dengue diagnostics across all states. And this should be also the enhancement of local manufacturing and reliable diagnostic tools. Diagnostics may not always be available, and especially during, there should also be local capacity to make sure that there is equitable access across the country. There's also a need for focused efforts on advancing the development of dengue-specific therapeutics. we know there are no specific treatments for dengue at the moment, making sure that there is sustained investment and research and development in dengue therapeutics is another key consideration for Malaysia, but of course for other countries as well. When we look at then Bangladesh, we can see that care management and case reporting is ranked quite high across the different pillars. This is because in Bangladesh, care management is provided diagnostics as well as provided almost free of charge for those patients who seek help and seek support at the hospital. Case reporting is also conducted at the national level. But overall, the recommendations is to strengthen coordination between the national and local governments, as there is still a fragmentation on how policies are being made and implemented. There should also be regular government meetings to streamline resource allocations that we had identified as being fragmented as well, to ensure consistent dengue control across the regions within Bangladesh. Another recommendation is to establish a nationwide vector surveillance system as case reporting is conducted, but vector surveillance was still at an infancy level. So including sentinel sites and routine data analysis will help with the management of dengue. And then lastly, to monitor global and local vaccination data, as there's no vaccine currently available in Bangladesh, to look into to make sure that there's opportunities for discussion on how dengue that vaccines can be introduced for national immunization policies. So this provides an introduction and high-level recommendations that we wanted to share with you today. There are more details in the white paper that you can look into afterwards as well. But we hope that by introducing some of these regional recommendations, it starts to spark conversation on how we can achieve some of these recommendations, which stakeholders need to be involved, how we can be engaging with them, and we hope to continue this discussion with all of you. The next section is quite exciting. We have organized a panel discussion with two distinguished experts in the dengue space. We'd like to use the panel discussion to reflect on the findings from the white paper and discuss how we can move from recommendation to action. So please help me welcome Professor Egi Arguni, who is a pediatric infectious disease consultant at the University of Gajah Mada in Indonesia. Professor Egi has been a key leader in the national dengue research and actively contributes to vaccine implementation efforts and surveillance initiatives across Indonesia. Joining her, we have Dr. Bhaskar Shenoy, head of the Department of Pediatrics and chief of the Division of Pediatric Infectious Diseases at Manipal Hospital in Bangalore, India. He is also a chairperson of the Pediatric Infectious Diseases Academy and brings extensive experience in dengue clinical care, capacity building, and national guideline development in India. So thank you both very much for being here today and participating in the panel discussion. So we can get right to it. We have a few questions prepared for our panelists here, and I can get started, but also feel free to do a short introduction before you start. So thinking about the recommendations that we have provided in the white paper and bringing together different stakeholders together, what are some best practices on what evidence or advocacy strategies have been most effective in influencing national or subnational policy making? Professor Egi, if you would like to start.
Yes, thank you so much, Rie, for the nice introduction. I will not add any more for my information. according your questions, I think in Indonesia, the effective dengue control relies heavily on evidence-based advocacy and strategic engagement with decision makers. Some proven best practices include: one is the utilizing local and global evidence. It's about the regarding data-driven advocacy. We presented robust epidemiological data showing dengue's burden or economic impacts and cost effectiveness of interventions to policymakers. Local data can highlight the high-risk areas, prioritize resource allocation as well. And also the success stories. We shared case studies and pilot project outcomes where integrated approaches like community-based factor control or innovative technologies demonstrated tangible benefits. I could see, for example, of the Wolbachia study. After we finished the trial in Yogyakarta City, we conducted intense advocacy with the Ministry of Health, which is now currently piloting this technology in other cities in Indonesia. And then I think another examples is that by develop a clear and concise policy briefs that translate complex scientific evidence to recommendations aligned with national priorities. That such as sustainable developmental goals. And also we facilitated technical dialogue sessions, kind of workshop and high-level forums to build understanding and consensus on effective intervention strategies. Again, I would like to give our experience in the context of Wolbachia study. You know that the communicating about the basis of this method is quite difficult, right? Using the bacterium in the mosquito and the idea that we have to release the mosquito in the community, it is difficult, not only for the community, but also for the major proportion of the stakeholders. So by using common words and having clear and easy to understand policy briefs, and also by doing the intense technical dialogues, they have proven to be accepted. I think that is for me.
Yeah.
Thank you, Professor. Yep.
I think, can I add something? Yeah.
Yes, please.
Yeah. Hello?
Please go ahead.
Hello?
Yes. Can you hear us?
No, can I add something? Because the best practices on which the dengue control can be done, it is there is no one single method wherein you can do it. It is a multitude of best practices available across the globe, and especially the Southeast Asian countries. Because if you look at the white paper, each country has one innovative and one good practice. For example, Singapore has a robust way of reporting, and Malaysia has something like a iPhone related, way of recording, and India has something like a dengue war room, wherein during the dengue season you establish that war room, and that takes care of the any eventualities and any suggestions. So with that, what I feel is the existing Southeastern countries, whichever 10 countries you have mentioned in the white paper, each country has its own way of doing it. And probably we can take the best out of all the countries and make a clear-cut guidelines wherein that can be implemented by the countries, and that would be the best. And most of the countries, they are lacking in the surveillance system. And that is one thing I think every country has to improve on that. That should be the best practice, whether the case reporting or the vector surveillance. These are the two important things. As Madam has told, the vector control, whatever the genetics and other things, it is a difficult one, but in the long run, that is going to help it. Involvement of the community in the dengue control is another important thing that some of these countries like Singapore, they have implemented in the school curriculum also, and to the general public, maybe through the social media, maybe through the other ways. I think we can improve that. And the most important thing is the vaccine. Some of the countries have come out with the recommendation for vaccine, whether it is regionally or in the country wise. But that is one thing probably all of us should give a important, in addition to integrated vector control programs, the reporting, surveillance, and these things. That is my take.
Thank you very much for sharing your insights. And to follow up maybe some of the questions that I had as I was listening, the sharing of best practices is important. It also includes multiple stakeholders to get these initiatives started. How would you recommend a country who may not have a dengue task force to start? Who would be the key stakeholder that should be leading these initiatives, and what should be those first maybe 3 steps? Professor Ike, if you'd like to start first.
Hello?
Yeah, Dr. Bashar, you can start first.
No. The question, can you repeat the question?
Yep. The question is what you had mentioned, the need for sharing best practices, the need to make sure that there's vaccine surveillance, case reporting, all of this is being conducted. It requires many different stakeholders to get that started. For a country that may not have a dengue task force already in place, what are a few recommendations that you would like to give, and who should be the one leading these activities?
So it is not a one agency job. Here, the multiple stakeholders are involved. And it is again, the involvement of the stakeholder depends on the country. For example, each country will have their own way of looking at the legislation, etc. When it comes to India, it is the central government. Then there are more than 30 states, and each state is having a government. And health is a not a central this thing. It is a division between the two, and both governments have to involve themselves in tackling this. The center can have a legislation regarding reporting and other things, but the implementation part is by the states. And not only that, we can involve the community and even the professional bodies. For example, Indian Medical Association, the Indian Academy of Pediatrics, wherein the healthcare professionals can take active part in educating the fellow and educating the community. Because India, with such a huge population and a vast country, it is very difficult for one agency to take care of the whole thing. The other thing is the type of care or the type of recommendation is different between the states, and we should have a uniform policy regarding the record. I mean, the surveillance or reporting. Reporting is mostly now being taken care recently, wherein if a dengue positive by ELISA, any lab diagnosis, the lab will inform the system, and thereby the public health people will visit that place or the house, and then it is retrospective than from the clinician. because there is a possibility that missing by the clinician. So the lab data which goes into the system or the government, and then it comes. So that is how these improvements are taken. So responding to your question, the multiple stakeholders are involved, and pivotal is the government, NGOs, healthcare professionals, community health workers also play a very important role in that.
Mm. Thank you. Yeah, I understand. I think we also mentioned that it is a multi-stakeholder effort. So I think coordination is going to be key in this part. Professor Aggie, would you like to add to that?
Yeah. I also add that the initiative can also come from the academia. So the university and also Center for example, the tropical medicine or Center for any professional specialties, for example, they can come from them. And then sometimes they have the direct connection with the international level of institutional, for example, like a health institutional, for example, like WHO regional, or also the other international agency. And in turns that if they can advocate the international level health institution, so for example, the regional WHO can push or can share the data about the current epidemiology of dengue infection in certain countries. So they can push the policymakers or push the government to have kind of a specific body to think more about this dengue, because dengue is a very important public health concern and so on like that. Yeah.
Thank you for sharing that. And I think we wanted to follow up on the comment you had made earlier on the Wolbachia program in Yogyakarta. But could you share a little bit more on how the local authorities are monitoring the impact of the Wolbachia program being implemented?
Yeah. You may aware that our research for Wolbachia it is funded by the national foundation, Yayasan Tahia, the NGO of ADS, kind of philanthropy in Indonesia. And then it is the matter of research. So only for the research. But after that, we still want to do the monitoring and want to do the impact of this new technology to be impacted for our decreasing dengue cases. For example, during our research, we got the very good research of the decreasing of dengue cases and also dengue hospitalization. But we want to know up to now. We did the monitoring, and then we still need a fund. Okay, so it is a bit difficult for us, but fortunately, the Ministry of Health fund the monitoring, and also another funding agency from Australia can help us, support us to do the monitoring. So as the new technology, we still need the monitoring, and also yeah, and also everybody still asking for the question whether this technology is good to still have the decreasing number of dengue cases, or is increasing even though the Wolbachia already released in certain area. Yes, for the monitoring, we still need funding and the one who organized those monitoring.
I see. Thank you. And think we mentioned earlier, talking about multilateral organizations, that the role of these organizations providing funding is quite key, especially for the Wolbachia program that you had just mentioned. So thinking about these organizations, how best should we be seeking support from these organizations? How should we be engaging with them?
In fact, as you know, the Bill Melinda Gates or WHO, and there are the Malaria Foundation, I mean the Vector Foundation, all those things, Mosquito Foundation. So there are many organizations which are interested in funding and then improving the care and controlling the disease. So what we have to do is the way that we can go is they will do the mainly the research is more important. There are many areas wherein the further research is needed. They will fund the research and the development, even the development of the preventive measures, maybe the mosquito control or vector control, or even the vaccine developments or whatever it is. Then they even support the implementation part also, and then they may provide guidance. So with that in mind, your next question will be how do we approach them? So that is one common question. So wherein to get a help from them, we have to contact the agencies directly with our proposal. We first should have a proposal, what is the existing situation and what we are going to do and how it may affect the patient care, or how it will affect the country in reducing the burden of dengue, both morbidity and mortality. Those things we have to have a clear things, then we should approach them. Then we need to explore the funding opportunities, and along with that we should coordinate with the local governments also. So probably if the points are good, in the sense there is the way they try to look at is that the whether it is important or it is feasible, then probably they will do it. That's what I feel.
Yeah, can I add a bit? Develop an evidence-based proposal, like Dr. Bhaskar said previously, is very important. But I just also want to add that we have to also build the national and local ownership, and then we should garner support from your local government, local authorities, and also from the communities. Because I believe that many international organizations prioritize project with strong local commitment. Without that strong local commitment, maybe it's kind of difficult. We have to show the funding agency that we got the support from the local government, we got support from authorities, and also from the communities. Yeah.
So even just to approach the multilateral organizations requires cooperation across the different sectors in each country.
Yeah.
I think as we were talking about sharing best practices at a regional level too, we see a rise in dengue cases in Europe, and there's a lot of evidence-based approaches that are already being used in the Asia region. What would you say are some key recommendations that you would provide to the European region that are starting to manage dengue outbreaks?
So when it comes to the best practice across the surveillance or vector control or patient care, we have to divide. One is the clinical management, the reporting, and second is the vector related activities or the preventive activities. When it is reporting, the standardization of the cases is very important. And as I mentioned earlier, the surveillance, when it comes to point of surveillance, there there should be clear reporting guidelines to be established, clinical guidelines. And of course, we have WHO guidelines, and India, we have National Vector Control Board guidelines. And most of the guidelines, they are looking alike. Then the question of vector surveillance is another important point that we need to do it. And some of the countries which you have mentioned in the guideline, wherein they have the vector mapping or the hotspot mapping, the hotspot GIS related hotspot mapping. That is probably one of the good things that we can implement. Then reporting has to be done, and then serotype specific surveillance is a very important thing, because when you go for the vaccine development, these data may be very important to develop a good vaccine. So many of the countries, especially ours, we don't have much serotype related reporting. Then the third thing is the vector control, as we already discussed, the Wolbachia. In India, some of the pockets have been doing that, but that is not universal. I think the whole country, in a large scale, these should be taken, and the community engagement is another important. And when it comes to the dengue clinical care, it is the diagnostics which is very important, because accessibility to a very cheap and the robust diagnostic technique is missing in some cases. And now the government has made available across the government hospitals. It was available in private, but ELISA method is taken as the confirmatory. In fact, in a private setup, it used to cost a lot, wherein the other people could not come, the lower socioeconomic people. But now the government has put a cap on that, wherein above this particular charge, you can't do it. So that is one good thing that the government, and as I mentioned, one of the best practices, the dengue war room, there is somebody to monitor and guide you throughout this epidemic. That is one more important thing. And they have been reserving beds during the epidemics in the hospital. The hospital gets flooded with a lot of cases, the regular cases plus dengue cases. So they reserve beds, something like what we did in COVID, that one ward for COVID. So similarly, 5 to 10 beds in a smaller setup, maybe a taluka. Taluka is a smaller place, then a district, then the state. So it's like that. And as I told, the vaccination is another important thing that we should look at. And India, right now, there is no recommendations, but they're doing the studies as per the recommending authorities' guidance. Probably in a year or two, it should come. But we are eagerly waiting that, because that is one thing which is going to change the scenario of dengue burden in India. And the mapping the hotspot is another important thing that I discussed. And the other important thing which we are facing is that the mosquitoes have developed resistance to the existing chemicals. So that is one more thing. And mosquito, the rapid urbanization, the industrialization, the movement of the population is creating a lot of problems in the dengue control. And especially the workers, there are a lot of newer buildings are coming. The workers stay there with the not giving much importance to water collection and other things. So that becomes a mosquito breeding place, and then the dengue. So these are the things that we should look at when the best practices that can be implemented.
Okay, thank you so much. And a lot of the best practices involves data sharing. It is also as part of our recommendation as well, so that the countries can share data and surveillance amongst one another. But for countries that may be more reluctant, or governments that may be more reluctant to share data, how can we approach this barrier? What can be shared to make sure that to convince government that that information sharing leads to more precise dengue control?
In fact, in India, there is a public domain, the government website. The data is shared, the number of active cases or deaths or hospitalized. So that statistics will be there. But the problem is whether the reporting has been very proper, whether it is a underreporting is there, or because if you see the statistics, there is a drastic drop in the number of cases from last few years. So whether there is underreporting is occurring, or probably really the interventions have helped us to bring down the cases, or probably our outlook, the clinician's outlook in early diagnosis and giving a proper treatment, the appropriate fluid management, that is the key in dengue. So that is helping us to reduce the mortality. We don't know, but definitely there is a downward trend in the number of cases. But still, I feel the actual cases may be much more, because the private practitioners, India has two sets of healthcare providing. One is entirely government, the another is the private sector. And the private sector right now do not have a binding to report all the cases of these infectious diseases. That is the problem.
Mm. Okay, thank you. And Professor Aiki, was there anything else that you would like to add to the questions on the best practices for Europe or data sharing?
Yeah, for data sharing is also difficult if if in Indonesian context. Yeah, but all I can say is that we have to do the intense advocating to government and also to the another institution, for example, like the professional institution, or also the specific task for dengue and so on. Because by doing the good and intense advocacy, I hope that the understanding of having this data sharing is not it's not dangerous for Indonesia. It have the more benefit for us here. Yeah, it's difficult actually.
Yeah, quite challenging. Thank you. We do have one question from the audience from an individual from UAE. So the question is, there are two technologies that came to our knowledge. The first one for vector control is genetically modified male Aedes mosquitoes to control female Aedes mosquitoes. The second one is Wolbachia bacteria to control the Aedes mosquitoes. Which technology is better based on the biosafety aspect?
You mean one is the bacterial based, second is genetic modification, isn't it? Yeah, see, genetic modification has been tried in many of the centers, and there are some papers, but the thing is that is more easier to do than easier to implement than this one, the bacteria based, because bacteria based you have to grow, then send all those things. So both have their pros and cons, but genetic modification is much better. That's what I feel.
Okay. Could you share a little bit about why it would be better?
Pardon?
Could you share the rationale for why you would recommend the genetically modified Wolbachia bacteria?
No, genetic modification, once it is done, then it continues. So I feel that is, and gene drive technology, and once the genetic modification is done, they cannot, they are incapable of transmitting the virus. That is what we look at. So that way it helps in controlling the dengue.
Okay, thank you. Yeah, Professor Aiki, would you like to add to that?
Yeah, if I'm not mistaken, took your the question is that between the male Wolbachia and the male and female Wolbachia methods, right? Okay, so for example, like, Singapore, they use the suppression method by release the male Aedes aegypti containing Wolbachia. For the country who very advanced, I mean, have a very good support from the government, not only for the approving for this method to control dengue, but also the technology and also the budget to do that. Because it is not sustainable. While you have the decreasing number of mosquito population, at the certain time you should do the release again, and so means that you have to do the release of mosquito again and again and again. And for those countries like Indonesia, who we don't have that advanced support like Singapore. So we choose the method of replacement methods. So means that we release the both male and female Wolbachia containing mosquito, Wolbachia mosquito containing Wolbachia. So by doing this method, this is more sustainable for us. And then if we got the certain area that already released Wolbachia mosquito, we hope that it can replace the population of Aedes aegypti mosquito, and then it can be sustained. So it is more suitable for us. But I believe that every country has their own consideration. They have their own support and budgeting. So it back to your own country. Which method do you prefer to use? Thank you.
Okay, thank you. And I think given time, we just have one more question that we would like to ask both of you. And this is looking ahead, now as countries look into making sure we mitigate climate impact of climate change, how should we ensure climate-related transmission changes and urbanization trends are also incorporated into dengue prevention and control strategies?
So, Madam, you would like to answer?
Sure.
You
Yeah.
can.
Yeah. See, in fact, when it comes to the dengue prevention, the climate change, which is unrecognized, but still has a major role in spreading the thing, because climate change has caused increase of the number of mosquitoes, spread of the disease, all those things. So definitely climate change has a major role, and we never looked more into that aspect than other things. So I think we should look at even the climate change in the long run when it comes to the dengue control.
Okay, thank you. And Professor Agi, anything you would like to add to that too?
Yeah, it is very important because we also aware that climate change and also urbanization are something that we cannot avoid of, right? It happens. So I think that the dengue policy must be dynamic and flexible and also evidence-based. For example, like we already have the AI or the technology can predict or do the climate modeling. So we can use that to predict the outbreaks or predict the climate, another changes in climate, and also for the urbanization as well. And then the key key message is this is should be the dengue program should be adaptive and also resilient. So yeah, because we cannot avoid those condition. But again, I think I like the Singapore government rules that for always do the collaboration with the urban planning to build the buildings, so it can minimize the mosquito breeding site in your houses. So I think it is very good examples and very good best practice that can be adopted to other countries.
Thank you very much.
So, yeah, climate change can definitely alter the distribution and abundance of dengue vectors. That increases the risk of transmission. And as Madam has told, the urbanization is one important thing that is going in a fast pace. And we need to look at the factors, something like a waste management. That is one important thing that we have to look at. Then the poor water supply, and that leads to increased mosquito breeding places. All these things we need to look into when it comes to dengue control.
Yeah, and I think, organizations that look into like wastewater management are also partners that we want to collaborate with moving forward. And I think the key theme that sounds like from our discussions is it really requires different stakeholders, not just from health, but also climate, urbanization, education, finance, and really takes a large force to get together and align on the same narratives. I think we hope that this white paper becomes one step closer to bringing together these diverse stakeholders to make sure that there is, importance and of course benefit not just from a health but also economic standpoint to prioritize dengue from a policy making perspective. So just like to thank both of you again for participating in this panel and for sharing your insights on this. So thank you very much.
Thank you.
Thank you.
And with that, we have a few final slides that we would like to share with you on our next set of activities that we are planning as the policy working group. So I'll hand it over to David.
Excellent. Thank you so much, Ria. And before I do go on to these next steps, I'd just like to thank supporters of the Asia Dengue Policy Working Group as well, Takeda and Abbott, who have provided invaluable support for us to be able to develop this white paper and share these recommendations to control dengue and aim for the 0 dengue death target by 2030. So I hope this has been a good session for everyone to see the work that's been done to develop the white paper and to reflect on some of the recommendations. And we really hope this will be an opportunity not to have the audience just sit back and listen to us talk, but also to engage as well on the recommendations and how we can make them possible as well. Because I think they're really, really important interventions that we could be having. And sharing these best practices too, I hope we'll be able to advance dengue control, both within endemic areas like Southeast Asia, newly endemic areas and emerging areas like in the Middle East, Iran, for example. But also, like we said, there's a huge opportunity now to prevent the burden transmitting northwards as well to more temperate areas, so that we don't see the same problems take place there. So with this, we will be disseminating this white paper very broadly. So it will be available on our Asia Dengue Policy Working Group website, and we'll be posting it as well on our social media channels, such as LinkedIn. So please, if anyone would like to receive information, please do get in touch with us, and we'll be very happy to share. And we'll also be sharing this quite widely as well in the Asia Dengue Summit taking place on the 16th of June in Manila. So if anyone wants to discuss any of the areas within this, please do come to grab any one of us. I'll be very, very happy to dive into each of those areas. We have also had excellent collaborators to put this together. So a lot of them will be in the Asia Dengue Summit as well. So we'll be able to connect up and see how we can advance these conversations. And as we mentioned, the stakeholder network to put this together has been absolutely critical, we feel, and we're really heartened by the ambitions that our partners do have. So we're very much looking forward to sharing this more broadly with stakeholders across the region, different levels of country governments, all the way from top to bottom, and to be able to work together and collaborate to action these outputs from the white paper. So lots more to come, I feel. So just on the next page, since Asia Dengue Summit is coming up, I just wanted to highlight two sessions that we'll be holding at the event. So we'll have one session on the 16th, focused on testing, but not just testing, but testing as it applies to dengue control more broadly as well. So how we can leverage the data from testing, how testing tells us more about the status of dengue within a particular locale, and how this can help guide our public health responses as well, really to drive outbreak response, both the response and the prevention of outbreaks, all in all. So we'll cover different types of tests, the traditional tests that have been used for diagnostics and surveillance, but also some advanced areas as well, where we're seeing quite frontier science enter the spaces where this is taking place, such as genomics and nanopore technologies as well. So a very exciting area, we hope, with this very esteemed panel here. And we will also have a fireside chat as well with this excellent title, I must say, One Nation, Many Islands, Policy Making in the Philippines. So as it is in Manila, we'll have Professor Tiki Pang from the top of the event giving a introduction and sharing his experience from organizations such as the WHO. And also Dr. Eric Tayak as well, who is the former Assistant Secretary in the Department of Health, to share the experience that they've had within the Department of Health of dengue control and dengue management within the Philippines. Let's not forget that dengue hemorrhagic fever was first identified in the Philippines. So there's a long, long history within the Philippines of addressing and trying to control dengue. So this should be, I hope, a very, very interesting panel for everyone to attend. So yes, we very much look forward to having you there. Hello, Dr. Becky.
Okay, well, thank you, Daphne. I think with that, we would like to thank everyone who participated in the launch of the webinar, the launch of the white paper, and again, we will share the white paper with everyone once that is uploaded onto our website. You can access the website through these QR codes and follow us on LinkedIn as we have updates, not just on events, but monthly policy updates that we identify through the pillars that we're looking at. And again, we'd like to thank Professor Aggie and Dr. Bashkar for joining us as panelists today. Thank you very much.
Thank you very much.
All right, with that, have a good rest of the day. Thank you.
Thank you all. Thank you very much.
Very much.
Nice meeting all of you.
Thank you. Bye.
Bye.